Okay, here we go. Dr. Tim Wu, SoCal Bike PT. This one's specifically for my boy Tyler Pierce, Vegan Cyclist. VC, this one's for you, buddy. These are the first 3 exercises I give a lot of my riders who have impaired ability to kind of activate the glute complex in this region, and they are heavily dependent on using their hip flexors or their hamstrings or just whatever else to generate power on the bike. And we want to bring it back down to this like safe neurological level, laying down, where we can get some isolation of these muscles and then build ourselves back up. So the first one's called a clam. It's not new, but it's good to refresh how and the best way to do it, okay? So you're gonna lie on your side, use your yellow of the Perform Better band. It's kind of the easiest one to start. You're lying on your side, not on your back, stretching it out. Completely on your side. Your hips are on top of your other hip, okay? And then from here, you're gonna take your knee upwards, keep your heels together, to what's called end range. So as far as your hip will take you, before you start to roll, is your end range of your hip, okay? So mine is about there. If I go any further, I start to roll. So you want to maintain that up here, okay? So now, there's a couple strategies you can get your leg up here. If you're using your hip flexors or the stuff on the front of your leg, you want to make sure those are relaxed. If you're using your hamstrings, you want to make sure those are relaxed. You only want the side of your hip, your gluteus medius, and your gluteus maximus doing the work. So with this hand, this is your checking hand. You're going to be right here kind of tapping around. 2 reasons. One, you know that it's on because it's firm, but tapping helps give your brain a better connection in your brain map. The other thing you can do is you can push into the table lightly. That'll activate kind of your core region and give you a little more stability here. When you impart some more stability on this region, it'll help you activate your glutes a bit better. And then you're going to hold that. We're going for time. So the goal is to get to a minute without compensation, without turning on your back and looking all crappy, so that we reinforce the correct way of doing stuff and not reinforcing your compensation. So this is clams, okay? It's an up and hold. And make sure this lower part of your leg is completely relaxed, okay? If you're like tensing up down here, it's gonna cause problems. We don't need that, okay? So that's the first one. The second one is you're still on your side. The bottom leg is bent. Your leg's gonna be all the way out straight. You're gonna angle it up and back towards here a little bit, okay? So if you have difficulty getting that position, what you can do is go towards a wall. I'm gonna do mine with the table so y'all can see better. Here we go. So now we're against here. Kick the shoes off, keep my walls clean. So butt against the wall, back against the wall. My right leg is going up. Heel is contacting the wall, not pushing hard against it, just contacting it. And instead of my leg, my toes rotated down, I want to slightly rotate the leg upwards against the wall. And you're going to feel the outside of that glute firing, pushing against there. You don't want your hip flexors compensating. You don't want your hamstrings compensating. You just want to hold that leg up there, and you're going to feel that firing up. You can use your tapping hand to tap better so you get it more activated. You can also push a little bit into the table to fire up here. You don't want to go so high that you're arching your back and using your back to get your leg up there. Remember, we're focusing on isolation, the ability to get this muscle contracting and holding your leg up there. The goal is to get to about 1 minute with the yellow band before we progress to something harder, okay? So then the third exercise, it's gonna be kind of the most difficult because instead of laying down in that super safe neurological level position where you can't fall anywhere, we're now going into what's called quadruped on your hands and knees, okay? And this one's called hydrants. You're a dog peeing on a fire hydrant. I know, good graphic, but you know, easy to remember. So when you get your leg up, you wanna keep your back flat, bring your leg up and out, back a little bit, and when you don't want to rotate your foot towards you, you want your foot kind of like towards the midline of your body or your other leg, okay? So it's not this, because you're rotating your back. Keep the back flat, leg up and out to the side, so you get extension, abduction, and rotation at the same time. Whoop! And if your hip doesn't go that far, that's fine. Everyone's hip shape is unique. This is as far as mine goes. So now a great cue that I use, let me grab a helmet. If you're a bike rider, hopefully you got a helmet you don't mind kind of using for non-bike riding things. You put the helmet on your lower back and then go into the hydrant. So it forces you to keep your back nice and flat, keep your core engaged, and if you start to rotate and compensate, you drop the helmet, okay? So that's hydrants. You're gonna hold that. You're gonna feel it on your other leg too, because you have to balance your weight through your left leg, or in this case, my left leg. So we'll do a minute there, do a minute on the other side. Typically I tell people to do like 3 on each side. The goal is to get to a minute, but if you can only do 20 seconds before you start losing the form or you start compensating with all these things that we know we're trying to not compensate with, that's fine. So for example, if you start off with the clams and you can only do 20 seconds before your leg starts to fall, your hamstrings take over, or you start cramping out, like that's our baseline, that's fine. The goal of these is to activate, which means make a better connection between here and right here in an environment and context that has no complexity. Like you're not doing anything. You're not trying to hold a line in a crit or rail a jump on the mountain bike. Like there's no complexity. This is where we start, and then what we do is we progress this through developmental levels into quadruped and on your feet, and then we add complexity back onto the bike and integrate you into that way. We make you a better moving human being first, and then reintroduce you to being a dope bike rider, okay? Dr. Tim Wu, SoCal Bike PT, out.